Hello, my name is Bree Alter. I am making this video to elaborate on my decade-long mystery illness. I am sharing my story so publicly because I believe that this will benefit someone other than myself. I offer this freely for scientific exploration on topics of autoimmunity, neuroinflammation, and serotonergic medications. My case highlights the dangers of treating a neurological disorder as a psychiatric disorder. My story is a well-documented accidental human experiment that will immerse you in the joys of the American healthcare system and medical gaslighting. In short, I experienced 9 years of mystery symptoms tied to a childhood illness that was repetitively misdiagnosed. Incorrect treatments led to worsened symptoms with more diagnoses. After I went against medical advice, my deadly symptoms vanished, and residual symptoms became more predictable and manageable. At the time of recording, I have been free of deadly symptoms for 1 year, while previously not being able to go longer than 2 weeks. I had cleared every medical test, yet my multi-system symptoms worsened. My doctors had dismissed my complaints as psychosomatic and just kept pushing me to psychiatry. I've been in therapy since a young age consistently, yet none of them seemed to think my physical symptoms were psychiatric. In this 10-pound binder, I have extensive medical data in chronological order. It covers my care over 7 specialties, 1st through 4th opinions, and 31 emergency room visits. It includes regular blood work, medical notes, genetic panels, autoimmune tests, MRIs, X-rays, CT scans, medication history, ultrasounds, EEGs, EKGs, and more. I have compiled a summary of this binder, which contains no particularly sensitive details and is available for purchase. Serotonergic medications are any medication that affects the serotonin levels in the brain. Any combination of these medications can cause a dangerous condition known as serotonin syndrome. Serotonergic medication includes antipsychotics, SSRIs, SNRIs, MAOIs, TCAs, and some antiarrhythmics, antihistamines, antibiotics, antiemetics, muscle relaxers, and triptans. I'm going to tell my story a bit out of order. This is because while I had correctly identified what was killing me, the precursors went much deeper. What seems obvious with the timeline that I have put together was far from it at the time. I was unaware of these other details until 2025, a year into recovery, when my brain finally came completely back online. For the sake of a good story, I'm gonna leave you as in the dark as I was, but I'll get there. Skipping over my childhood, I had spent my teenage years in relatively good health. I have a cardiac condition which was symptomatically dismissed as anxiety, and I was unaware that my unnatural flexibility was because of EDS. I had diagnoses of ADHD and OCPD, but my physical health was unremarkable. I have unexplained episodes of staring spells, but this was assumed to be daydreaming as a kid. Keep in mind that these spells had been called multiple different things over the course of the years, so I just refer to them as staring spells until any of my doctors can agree on what they are. Okay, Jarvis started alerting. Good morning. Muy bien, Samia. That was a staring spell. There's one on camera. In 2014, about age 19, I fell ill with seemingly disconnected issues. Allergies, migraines, visual disturbances, and unexplained pain. This was shortly after a tick bite, but I had never seen a bullseye rash and was told it was a non-issue. I was able to dismiss the symptoms for the most part, but after a year, the migraines became so frequent that I had to seek help. This doctor had given me a complete workup for a baseline. He determined that my staring spells were actually absent seizures, though no future EEG detected seizure activity. He started me on anti-epileptics and triptans. I experienced severe symptoms that were likely undiagnosed serotonin syndrome. This included hallucinations, high blood pressure, and syncope. My doctor told me to wait it out, as meds can take a few weeks to work correctly. I ended up with 7.5 weeks straight of valproic acid toxicity and a death wish. Despite knowledge of the toxicity from the day of, this doctor actually wanted me to stay on this medication until I threatened to throw myself in front of a bus over the symptoms. He switched me to another anti-epileptic at a lower dose. When I complained about the side effects of my brain feeling like TV static, he labeled me as bipolar. With my family history, I wasn't unconvinced, but then he told me I had to choose between seizures or these severe side effects. At this point, I sought another opinion as it seemed way too early to have that sort of ultimatum. The bipolar diagnosis followed me and then painted a picture for all future doctors. My next neurologist only wanted to stick to serotonergic anti-epileptics because of their dual use for bipolar. I reacted to every medication he tried on me as well. Hallucinations and emotional volatility appeared during these medication trials. The only other time in my life I had hallucinated was when I was on high doses of lithium as a child. Yes, you heard that right. I'll elaborate later. I had never hallucinated off of serotonergic medications. Nerve pain, fatigue, muscle spasms, and emotional volatility arose after more trials with neurologist number 2. After he accused me of being uncooperative, I discontinued services and medication. I was doing everything I was told and felt like I was imploding. My mental health tanked from a year of back and forth on medications, and the hallucinations were blamed on family history instead of medication. I started therapy services after quitting neurology. I was prescribed an SSRI for my anxiety and insomnia. This medication made me feel just as terrible as the others. I assumed that I just have bad luck with medication at this point. Nothing does what it's supposed to, and I react to literally everything tried on me. I remained in therapy, but I gave up on medication at this point. My symptoms returned to baseline. Nothing that couldn't be explained by ADHD, OCPD, and an anxiety disorder. In May 2017, I developed scarlet fever. When I recovered, bradycardia and chest pain persisted. Syncope, temperature dysregulation, and erratic blood pressure also began, later being diagnosed as dysautonomia. 4 months later, I had developed a minor cold and sinus infection. I had used Mucinex to treat it, which is also serotonergic. My boss sent me to the clinic to get a work note. They would not clear me and sent me to the emergency room because they were baffled that I was upright at 40 beats per minute. My cold was diagnosed as Wolff-Parkinson's-White syndrome, which also explains some of the atypical episodes that were always labeled as anxiety, except the condition is consistent with tachycardia, not bradycardia, and I get both extremes. My doctor never quite explained other than I had an atypical presentation of the condition. I was scheduled for a cardiac ablation surgery, but it was unsuccessful. They put me on serotonergic antiarrhythmics to address the erratic heart rate. This medication made me faint at work, and I quit it. There were no alternatives, as treating tachycardia worsens bradycardia, and vice versa. So the doctor dropped me when he could no longer help me. At the end of 2018, I was on no medication other than intermittent triptans. Some of my symptoms, such as hallucinations and emotional volatility, had disappeared. My autonomic and cardiac symptoms worsened. My muscles constantly spasmed, and the rigidity had caused structural issues like lumbar lordosis and cervical kyphosis. I would rapidly cycle from normal energy levels to bedridden without explanation. My mental health tanked once again, and psychiatric medication was tried. All antidepressants threw me into a constant state of mania. further solidifying the theory of bipolar. At this point, antipsychotics were suggested instead. Hallucinations began again, but were so intermittent it was hard to place blame on the medication. I had assumed they arose when I was more stressed out, though not a rule. While my behavior was labeled as bipolar, I was an atypical case. My depressive and manic episodes were brief and rapid cycling. Depression didn't particularly affect my mood, but more my motivation and energy. Mania, in hindsight, only occurred on medication and was redirected into healthy outlets, minimizing the struggles that most deal with. My therapist did not know what to do with me, because while I was begging for help, I was highly functional. But it just existing took so much energy out of me, and many assumed my symptoms were attention-seeking. In 2019, my psychiatrist labeled my symptoms not as bipolar, but as schizoaffective disorder. More antipsychotics were trialed, all having more deal-breaking side effects. Again, I gave up when my reactions were considered as me being uncooperative. I decided to try a third neurologist. The EEG showed no signs of seizure activity, despite my staring spells being as consistent as ever. She called them pseudo-seizures instead and put me on another antipsychotic. Since my episodes are medication-resistant, she thought an antipsychotic would address the stress levels that likely triggered them instead. It didn't, but I cooperated because I didn't have any better ideas. This medication caused the hallucinations to return. Stevens-Johnson syndrome melted off half of my face. This was the most excruciating pain I had ever felt, like a skull-deep chemical burn affecting every cell individually. Urgent care dismissed me the first day. The emergency room dismissed me the second day. Another emergency room out of town determined it was from lamotrigine toxicity and put me on heavy-duty antibiotics. After fainting at an event, I woke up to polka-dotted swollen skin. I learned I was allergic to sulfa antibiotics. For context, the available blood work gives reference to my only true allergy. Autonomic systems worsened and inconsistent allergies appeared, usually in the form of hives with no clear trigger. Again, I gave up on addressing the staring spells. In 2020, I contracted COVID-19. It took me 9 months to fully recover, the bradycardia becoming debilitating. My cardiologist still insisted nothing was wrong with me other than Wolff-Parkinson's-White syndrome. During this time, I dropped all medical care. No one was helping me anyways, and the extra human interaction was not ideal with this virus going around. My mental health tanked again. In 2021, now 7 years of mystery symptoms, I sought out a fourth neurologist. This was the only one who took me seriously. I was diagnosed with fibromyalgia and chronic fatigue syndrome and prescribed serotonergic medications to address the symptoms. I began hallucinating again, still not assumed to be my medication, but intermittent and consistent with schizoaffective disorder. My memory became alarmingly unreliable, and taking my medication was difficult. My psychiatrist then put me on an injectable form of my medication to help. I quit the pain meds because I couldn't remember to take them, but by all means it seemed like staying on the psych meds was a good idea at this point. The hallucinations persisted through the medication, and I gained 30 pounds. Another antipsychotic was added to counteract the weight gain, and I was re-prescribed serotonergic pain medication by my physiatrist. Every single doctor was aware of my medication history and current usage. None of them seemed to think that being on 5 serotonergic medications at once was an issue. In 2022, a new issue developed: cyclic vomiting. Everything prior was still a mystery and loosely categorized as a dozen different conditions. This was assumed to be disconnected. During these episodes, I would vomit every 10 to 30 minutes for 2 to 10 days at a time. A sip of water or any food would reignite a flare. If my stomach was empty, I would vomit bile and blood instead. Excessive sweating, low heart rate, pain, malnutrition, and dehydration. After 4 days, I tend to go to the ER for fluids, but never received any relief or explanation. It would pass on its own and then start back up within a week or so. This went on for 2.5 years straight. I had every test under the sun done, and no cause was found. I developed esophagitis, and my doctors actually blamed heartburn, despite the treatment not stopping the vomiting. I had given myself a hernia from the vomiting, and my doctors still insisted that I was making myself sick with stress. I had an anxiety disorder my whole life. While gastro symptoms are common, that is never how it affected myself. I was not vomiting because I was stressed. I was stressed because I was vomiting myself to death, and my doctors kept telling me it was in my head. Surprise, serotonergic antiemetics did not stop my symptoms. I could not keep down my medication at this point, and Abilify injections were the only thing I was on. After some more research, I learned a very rare side effect of Abilify was esophagitis. I brought this up with my doctors, who told me to stay off of Wikipedia and trust the professionals, as if that's helped me at all at this point. They agreed to switch to another serotonergic antipsychotic. When my symptoms remained, they said that that was proof that it was not my medication. With my knowledge at the time, that seemed reasonable, and I stopped suggesting my antipsychotics were what was killing me. All of this medical drama aside, I was still trying to function as a normal human, which comes with its own inconveniences. I run my own business and manage a lot of side projects. Trauma didn't spare me, bills still had to be paid, 2 friends committed suicide, and loved ones bailed on me. All while my brain refused to cooperate, my blood felt as if it were on fire, and my doctors stopped trying. My mental health tanked again. I was put on a much higher dose of my antipsychotic. At this point, my medication had completely numbed any emotion and caused some uncharacteristic behaviors. Occasional bouts of emotional volatility had people thinking I was on drugs, and many left me. My muscle spasms and nerve pain worsened, and my personality fizzled into a shadow. My mind had always been highly active, but it had slowed to the point that I felt lobotomized. I could feel my mind slipping, and finally believed my doctors that I was just insane and must be in denial. 2023 through 2024, I stayed in therapy and continued a high dose of an antipsychotic, but stopped seeking other medical care. No one seemed to think anything was wrong with me aside from poor mental health. The last ER trip told me again that nothing was wrong with me. I stopped going to the ER for vomiting, and my flares increased in frequency and severity, the dehydration likely being a factor. I learned that 110-degree baths paused my symptoms. Not showers or heating pads, but submerging up to my neck. I had figured maybe it stimulated the vagus nerve just enough to give me a break. Likely not the healthiest thing, but it was the best I could do. Ice baths would have likely done the same thing, but I live in Arizona where cold water is a fantasy. I would have up to 10 of these scalding baths a day. My skin was in terrible shape, dysautonomia symptoms worsened, but I was able to force bits of liquid during these baths. In June 2024, I returned to the ER during another vomiting flare. My cardiac symptoms displayed differently, and something was wrong. The doctors suggested it was because I wasn't taking my old antiarrhythmic prescription. My brain was still alarmingly foggy, and I could not recall why I quit that one. I restarted it and got even worse. A week later, I returned to the ER for the same complaints. They insist nothing is wrong with me after an EKG suggested otherwise, so I left against medical advice. That night, I went home and had a heart attack. I passed out and had a near-death experience and woke up in my bathtub. I did not know it was a heart attack until my next doctor appointment, but I knew something worse and atypical had happened. I cold turkey quit my medication at this point. What's it gonna do? Kill me? I'm already dying. My vomiting flare continued for the longest it had ever lasted, 9 weeks straight. Something was different. The scalding bath trick no longer paused my symptoms, just relentless vomiting for 9 weeks straight. It had finally ceased, but I knew a flare would just return in a few more days, as it always had. At this point, I gave up. I started getting my record straight, so when I died, the people around me would have an easier time. Except 2 weeks went by with no flares. This is the longest I had gone without. Now I suspected the atypical lengthy flare was more relevant to withdrawal symptoms. My brain was starting to come back online. 2 months go by, and now I'm confident. I was right the whole time. My antipsychotics were causing the vomiting. I had no medication in my system at this time, and the chest pain, bradycardia, and vomiting had entirely ceased. I brought this information to my team of doctors. My cardiologist and gastroenterologist pushed me to new doctors unfamiliar with my case. The gastroenterologist did not care, as I was a new patient coming in to say that there was nothing wrong with me. The new cardiologist told me to go back on my medication. I told him no, and he proceeded to treat me as if I was having a psychotic break. Admittedly, I was getting agitated with the clear discrimination. Be it misogynistic or psychiatric, I'm not sure. If you are female presenting, any emotion is labeled as a problem if you aren't cooperating. I walked out and never returned. I returned to my PCP to show her the evidence, and she agreed that my antipsychotics were responsible. My symptoms had gone back to how they were in the early stages. Dysautonomia and staring spells continued, but chronic pain and fatigue minimized. My deadly symptoms had disappeared entirely, and my brain came back full force. I started writing a book after having a near-decade lapse in any creative ability. After 8 months into recovery, I had an epiphany. What if all of these symptoms were connected? Could my prior symptoms have been a more mild version of the vomiting? I had begun digging into my medical records to try and connect the dots. The evidence was as clear as day. While I was correct that the vomiting was because of my antipsychotics, I clearly did not have an allergy. Why did this happen? Because of serotonergic medication in general, which goes beyond psychiatric prescriptions. I started compiling the book that I have available to explain my symptoms. Honestly, it began as a coping mechanism for this whole thing. Yeah, the OCPD is apparent, but occasionally useful. I still had no idea why I couldn't tolerate these medications, but I knew what I needed to avoid now. I should avoid a long list of medications, including Benadryl, but simple enough. Now, back to the story being out of order. No, I'm not done yet. We skipped my childhood. Remember the lithium I mentioned earlier? The original reason I had started therapy was because of childhood trauma. I had a 4-year bit of my life where I have next to no memories. Trauma had always been assumed, but no attempt to regain the memories gave me any insight. I was a very normal child before this. Straight A's, involved in theater and sports, outgoing and socially bold even. During this mystery illness, I still tried to address this riddle on the side. In 2025, I was finally approved for EMDR therapy. A relevant session and a traumatic event that shortly followed led to a flashback that filled in the rest of my story. Still skeptical, my childhood medical records confirmed it. The reason I couldn't remember those years wasn't because of repressed memories. It was because my brain was nuked on lithium. There simply wasn't much to remember. I had remembered all of my trauma, which followed the medication and was not relevant to the amnesia. As a kid, I had gone to Hawaii for vacation. It was my last vivid memory. I had a great time swimming with the dolphins near a Captain Cook memorial and playing with the stranger-friendly Mustangs. When I returned home, I had developed strep throat. This is where the flashback came in. I felt my brain cooking. I had experienced fevers throughout my life, but this was something on a different level. When I recovered, my family had acted like I was swapped with a version of me that no one wanted. My personality changed, grades dropped, and I developed some odd symptoms. The symptoms included the sudden onset of staring spells, body-focused repetitive disorders, anxiety, depression, bedwetting, chronic nasal inflammation, sleep disturbances, separation anxiety, difficulty concentrating, reduced coordination, and sensitivity to light and sound. At this point, it was assumed to be psychiatric issues, and I was put on very heavy medication. I'm not going to get into how those years went for me here, as I got worse from incorrect medications, but at age 12, I was pulled off after an odd reaction. It was described as some sort of severe dissociative event. I quit the meds and my psychotic symptoms vanished. I retained ADHD, OCPD, and staring spells, but was otherwise fine until I sought out treatment for migraines 6 years later. My medical history and early symptoms indicate an oversight in my childhood medical care. There was no definitive test for these conditions, but I do have a long list of everything ruled out in a decade of testing. This is classic for PANDAS, which was only just emerging as a diagnosis when I was going through this. Autoimmune reactions, viral infections, and high fevers are known to cause neuroinflammation. Neuroinflammation of the basal ganglia has been associated with OCD and ADHD-like symptoms, as well as dysregulated serotonin signaling. This explains my hypersensitivity to serotonergic agents and my inconsistent psychotic symptoms that vanished by leaving my neurotransmitters alone. Based on my medical history going back 20 years, with what extensive medical testing has ruled out, I hypothesize that my condition involves chronic low-grade neuroinflammation from a severe childhood fever. This caused a hypersensitivity to serotonergic antagonists. By treating my neurological symptoms as psychiatric symptoms, it made a dozen conditions pop up that vanished or minimized by cessation of triggers. Fast forward to today, and I am still seeking treatment for residual symptoms. I have tracked dietary serotonergic and neuroinflammatory triggers and symptoms extensively. I have come to some interesting conclusions myself, and by experimenting on myself, I have found consistent relief from many symptoms. Dysautonomia and staring spells being the only ones evading resolution, which may simply just represent brain damage at this point. For clarity, my psychiatrist, past and present primary care doctor all agree with me. My gastroenterologist and cardiologist agree that I no longer need their care because the issues were never gastro or cardiac in nature. As of this recording, 4 neurologists have rejected my case for being too complicated. The Mayo Clinic is my best shot, but there's a bit of a paywall to make that happen. This is not me self-diagnosing. This is me finding a clear pattern to my decade-long health mystery after being told it was in my head for years. I am still seeking proper treatment and a medical professional that can do something useful with this data. A large range of patients with invisible illnesses experience a similar scenario. Science does not lie. We just learn more and do better. Because I react poorly to these medications does not mean we have the same factors. Trust your doctor, and if you don't, go find a more trustworthy one. I believe there is a systematic issue that made this scenario so drawn out, but I trust medical science and I do not suspect a conspiracy. Medical professionals are only human and are only as helpful as our current understanding. I believe that the lack of conversation on these topics is a large part of the problem and why the medical industry has such a difficult time dealing with this not-so-unique scenario. We don't have to suffer. We just need to learn more and cooperate. We aren't going to do that until people start telling their stories and doctors start putting their heads together with more accessible data. This is possible, and you are not alone. Thank you for listening to my story. Please share this anywhere that you think may be useful.